I am David Okonkwo from the University of Pittsburgh, speaking on behalf of my fellow co-authors Kevin Wang and Andras Buki on biomarkers for traumatic brain injury. The key concepts we want to share with everyone are that TBI biomarkers are surrogate indicators of brain trauma pathophysiology and can be measured in blood, CSF, or saliva. Biomarkers have been in development to aid in diagnosis, prognosis, treatment, and monitoring of traumatic brain injury, and that's across the full spectrum of injury from concussion to coma. And in fact, we've had a major breakthrough in the field where 2018 marked a seminal moment of the FDA clearing a biomarker for clinical use. That biomarker is based on a panel of measuring GFAP and UCHL1 in blood. And TBI biomarkers of a host of pathophysiologies, including injury to gray matter, white matter, neuroinflammation, neurodegeneration, and other manifestations of traumatic brain injury, are all under intense study at present. And we anticipate that several TBI biomarkers will be submitted for FDA clearance for broad clinical use in the coming decade. As I indicated, February 2018 was a critical moment in the history of our field in that the FDA approved a test called the Banyan BTI test through its Breakthrough Devices program as the first biomarker ever approved for clinical use in the diagnosis of a traumatic brain injury. That clearance was based off of many years of effort by a host of investigators, but the culminating moment was the pivotal trial known as the ALERT trial, a multi-center observational study that confirmed the sensitivity, specificity, and positive and negative predictive values of this panel of GFAP and UCHL1 combined for the prediction of a positive intracranial head CT in trauma patients whose blood is sampled within 12 hours of injury. The limiting factor of this particular test is that it is a core lab test that requires 6 hours to return a result in many cases, and that represents a barrier to broad clinical adoption. But as I will discuss shortly, there are some very important efforts underway that will get us to a highly clinically useful biomarker in short order. We use biomarkers for many reasons, and the diagnostic biomarker is perhaps the one with which physicians are most familiar, and that's a biomarker that categorizes a person by the presence or absence of a specific physiological or pathophysiological state or disease. And we're all well aware of these biomarkers because we use them every day in our practices. In fact, if you think about the modern era of cardiac care, what would that be in the absence of the diagnostic biomarker of troponin? In fact, a 54-year-old male who comes to the emergency department complaining of chest pain undergoes an EKG and a blood test. And on the basis of those tests, if they're normal, the person is often sent home, perhaps reassured that maybe this was an anxiety attack, but clearly not a heart attack. And if those tests are mildly abnormal, then an additional set of tests will be employed. And then there's a whole range of treatments that can be used to affect heart function. And if those tests are severely abnormal, the patient is admitted to the hospital, sent to the cardiac catheterization lab, and undergoes a life-saving procedure. We want to see the same for traumatic brain injury. And the fact is that we're not that far away from the moment where someone who is brought to medical attention after sustaining trauma to the head can have a finger stick, pinprick, drop of blood loaded onto a cartridge, and then very, very specific information can be gleaned from that. And this has relevance to both military and civilian health. So picture a corporal who's injured in a training exercise, sustains trauma to the head, and is complaining of headaches and dizziness and some nausea. Well, the day is coming where a finger prick drop of blood can indicate that if those biomarkers are absent, the corporal can be returned to duty and reassured that everything's going to be okay. If they're mildly abnormal, the corporal will be sent for additional testing to further clarify the extent of his traumatic brain injury or concussion. And if they're severely abnormal, that person can be brought to higher roles of care for more definitive evaluation and management. But there are a number of types of biomarkers besides just diagnostic biomarkers, and they include prognostic biomarkers, predictive biomarkers, pharmacodynamic biomarkers, efficacy response biomarkers, and others. And beyond just the context of use, as they're called, we also want to hone in on biomarkers that reflect very specific pathophysiologies. And you can imagine the manifestations of this, not just for traumatic brain injury, but for other neurological disorders, that if we can pinpoint through the measurement of biomarkers, whether it be in blood, spinal fluid, saliva, or another biofluid, that reflect whether the issue is injury to gray matter, white matter, supporting vascular structures, or otherwise, we can hone in on exactly what's going on inside of the central nervous system and get us to the point of being able to do targeted therapies. An important moment happened back in 2017 where for the first time, this concept of a patient having a finger prick drop of blood obtained and then measured to assess the presence or absence of biomarkers actually occurred at the University of Pittsburgh. A 40-year-old male who sustained a traumatic event in an assault with loss of consciousness. He doesn't remember what happened. He had alcohol on board, but he was a GCS 15, was enrolled into a research study wherein a finger prick drop of blood was loaded onto a cartridge of a research prototype assay. And that measurement indicated that his GFAP and UCHL1 were elevated, and in fact, that person had a positive CT. And a similar event happened at UCSF, at San Francisco General Hospital, also that year. In someone who was more severely injured, those biomarker levels were vastly higher, and the head CT showed a concomitantly more pathology on CT scan. And the data from this first experience of using a point of care device for blood-based biomarker testing was published in 2020. It's an effort out of the TBI consortium, and a prototype assay that can return a result in under 15 minutes has an exceptionally high AUC for the receiver operating characteristic curve, indicating that this is a valid diagnostic biomarker test. And in fact, the higher the biomarker level measured, the more significant the pathoanatomic features were seen on the accompanying CAT. This is in fact a game-changing moment for clinical care and research in traumatic brain injury. And it really starts to hone that compass down a path where we will achieve FDA clearance of biomarkers throughout a host of uses. And as an example of where we may be heading in the world of prognostic biomarkers, which are biomarkers that categorize patients by the degree of risk for disease occurrence or progression of a specific aspect of a disease, we look to data that was published some years ago out of Sweden, where professional hockey players were enrolled into a program where blood sampling was performed prior to the season. A significant percentage of those players who had preseason blood sampling went on to sustain a concussion, and many of those that sustained a concussion underwent repeat sampling. And what was discovered is that there are, in fact, biomarkers that are strongly predictive and prognostic of delayed functional recovery and a delayed return to play. And when this observation is taken to a deeper level and then subsequently validated, we will get closer to the point of having clinically useful prognostic biomarkers. We saw a similar pattern emerge from the TBI consortium, where measurement of GFAP was associated with levels correlating with long-term outcomes out to 1 year, where the higher your GFAP level, the more likely you were to sustain a poorer functional outcome. Perhaps the holy grail of TBI biomarkers would be an efficacy response biomarker, which is a biomarker that predicts a specific disease-related clinical outcome and can thus serve as a surrogate for the clinical efficacy of a treatment. And we know how efficacy response biomarkers have impacted other fields. A notable example of that are the biomarkers in cancer, such as prostate-specific antigen, that have radically revolutionized how clinical trials are performed and how quickly you can return a result of understanding the impact of a novel treatment in those diseases. We want to see those emerge in traumatic brain injury. We also want to see the emergence of biomarkers that give us a full sense of the spectrum of this problem from acute to chronic. So we want biomarkers that are going to tell us about injury in the hyperacute phase, but we also want to be able to identify biomarkers that gain insight into what happens downstream, including in the world of the neurodegenerative implications of traumatic brain injury months to years down the road. So in sum, we are at a point where a TBI biomarker has gotten over the finish line at the FDA and has now reached the point that it is available for clinical use. But we are going to see a significant number of biomarkers reach that similar stage with the FDA in the years ahead. And the day is upon us sooner than later, where we will be able to measure biomarkers in blood to give us insights into the patient in front of us and how best to treat that patient following a traumatic brain injury. Thank you.